Hi, everybody, and welcome back. Today we're going to be focusing on the DARP, or focus notes, or focus charting. Focus charting, as I mentioned, is also known as DARP notes. So by the end of this, you'll be able to explain the method, write entries using data, action, response, and plan, and avoid common pitfalls. You're going to think of this kind of as storytelling for clinical care. So it's a little bit different than the notes that we've talked about previously. So why does documentation matter? So documentation isn't just paperwork, even though it can, be something that is lengthy and you feel like is pointless at times and takes a lot of your day. It's more than that. It's going to ensure that the next provider knows what exactly happened. It protects us as professionals legally, and it shows whether interventions are actually effective. So the focus charting is really going to streamline this process, as we can see below. So what is the focus? The focus is like the headline of your notes. That's going to be a behavior, a therapy session, or a notable event. So for example, anxiety or the ambulation or patient education. So whatever you did with your patient that day, that's what the focus is going to be of your DARP note. So as with SOAP and burp and all of those other types of notes, each letter is going to serve its own purpose. The data section is describing the facts. That's going to be both subjective and objective. This is really what you observed throughout your session. The action is going to explain your intervention. That's what you did. The response is going to show how the patient reacted to your intervention that you were doing that particular day. And the plan is going to outline the next steps. But not every note is necessarily going to need a plan. So that's also something to keep in mind. You can continue with the same intervention that you've been doing throughout your time if need be. So just looking at a little example, this is showing a patient who's experiencing hallucinations. So we're going to see how each part flows logically into the next one. So we have these little arrows here. So again, we're going to say what was the observed, what was done, how has the patient responded, and what do you do next? So starting with our D, so the patient mumbled to self, pacing, unable to focus. That A, you're going to provide the cues. The R, focused more than 10 minutes, then they got agitated. And the P, continue recreation therapy. You're going to increase duration and reinforce attention. So your plan can be as simple as that. Another ambulation, so looking at a physical disability. So we can look at, here's an example of that. The action is going to be the environmental change, and the response demonstrated success. And then the plan ensures that the conditions are repeated for progress. So again, looking at that, the D, the patient stopped at obstructions and or tile changes. So that's kind of a change in the evenness of the ground, you could say. The A is you're going to make the tile pattern consistent. So if that's something that you are facilitating, then you would then obviously make a consistent tile pattern as a therapist. The R, they ambulated the length of the day room. And the P, maintain consistent flooring. So we can really see how everything kind of flows into the next. Some common pitfalls or mistakes, are just writing vague notes, kind of like we've talked about in the other sections, but saying things like the patient did well, mismatching actions and responses, or inserting personal opinions. Those are things that we definitely want to continue to keep out of these notes. You're always going to stick to measurable, observable facts and ensure the flow from the D to the A to the R and the P if need be, and you're going to just want to make sure that, everything makes sense. All right, so let's practice. So you can go ahead and pause here and kind of doing this on your own. You're going to draft a short DAR or P for these three cases that are listed below. So you're really going to want to think about what measurable data you'd include, what action you take, and what response you'd expect. And then again, if the plan is going to be useful to your note, then you can go ahead and add that. So the three cases, and they all vary a little bit from physical to developmental to cognitive disabilities. So the first one is the group participation due to depression. We're going to look at safety awareness with a patient who has a TBI or traumatic brain injury, and then how you would do a note for leisure skill acquisition for a patient with dementia. So you can go ahead and pause this video and do those on your own and kind of just get an idea of what this might look like. And welcome back from that little exercise. So we're going to go ahead and check in with a little quick quiz. So we're going to look at first, which letter captures the patient's change? And then secondly, when can we omit or leave out a plan? And then third, we're going to pick the best data statement from the two options. So either patient seemed fine or patient participated for 15 minutes and required 2 prompts. So kind of think about those answers to those questions. Again, write them down. Write down any thoughts you might have in the discussion as well. And then just to kind of summarize what we've talked about, here is a quick checklist. So if you're going to hit these points, then your DARP note is going to be concise, accurate, and clinically useful. So just some things to consider when you're writing your note. You're going to want to have a clear focus, contain specific data, have a concrete action, a measurable response, a useful plan, and objective language. So we can really remember that focus charting is a way to tell the patient's story through cause, intervention, and effect. So if this is done well, it's going to give the next provider a clear picture of where the patient is and what comes next. So that, again, is kind of the overall goal of any documentation, any note that you're using, is that it's going to capture something that anyone can pick up and be able to identify, where that patient is, what you've been doing, and how you've been effective. So again, hopefully this is another good note to have in your toolbox. Feel free to reach out with any questions, and I will talk to you all soon. Have a great day.